peripheral nervous system. Under the peripheral nervous system, we'll have 31 pairs of spinal nerves, 12 pairs of cranial nerves, and the automatic nervous system. In the spinal nerves, there are 31 pairs. They are the 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. So we all know the nerves are divided into sensory nerves, motor nerves, and the mixed nerves. Sensory nerves carry impulses towards the central nervous system, and motor nerves carry only the motor fibers, and mixed nerves will be both sensory and motor. This includes all the spinal nerves. So let us remind once again how the nervous system is classified. The nervous system is classified into two: the central nervous system and the peripheral nervous system. Under the central nervous system, it includes the brain and the spinal cord. Brain and the spinal cord. Then in the peripheral nervous system, it includes the motor neurons and the sensory neurons. Under the motor neurons is divided to somatic nervous system and autonomic nervous system. And under this autonomic nervous system, it is divided into sympathetic and parasympathetic. That means sympathetic will be responsible for the fight or flight action, and parasympathetic division will be responsible for the rest or digest. So now let's continue to the spinal nerves. Under the spinal nerve, we have the spinal root, then the branches and the plexuses. The nerve root, the spinal nerve roots arise from both sides of the spinal cord and emerge to the intervertebral foramina. Intervertebral foramina, these are the holes in which the spinal cord will be emerging. Then each nerve is formed by the union of motor and sensory nerve root, and is therefore a mixed nerve. So it is composed of the union of both the motor and sensory nerve roots. So it is the spinal nerves are because of this, the spinal nerves are called the mixed. Then branches. There are 3 main branches: the ramus communicans, posterior rami, and anterior rami. And the plexuses, there are 5 large plexuses of the mixed nerve formed on each root of the side of the vertebral column. They are the cervical plexus, brachial plexus, lumbar plexus, sacral plexus, and a coccygeal plexus. So you have to see how these plexuses, where these plexuses are located, from where it is originated, and what body parts they are. The next is the cranial nerves. So there are 12 pairs of cranial nerves originating from the nuclei in the inferior surface of the brain. Some are sensory, some are motor, and some are mixed, that is both sensory and motor. So it is usually written in the Roman numericals. This first one is the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So we can how we can remember the name through the mnemonic. Through the mnemonic, O, to touch and feel very green vegetables, always healthy. So by remembering this mnemonic, you can easily say by the words. Optic, oculomotor, olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and some of these cranial nerves are sensory, some are motor, and some are mixed. So how we will identify? We'll identify by the mnemonic. Some say marry money, but my brother says bad business, marry money. So by remembering this mnemonic, we can say this some S part is words which are beginning with S, these are the sensory. Then the words which are beginning with M, these are the motor, and the words which are beginning with B, like bird, brother, bad, business, so these are the mix. So like this we can identify whether it is sensory, motor, or mix. So we can also see in the picture that I have drawn. In this picture, if you see closely, you see the numericals. One is the olfactory. It is located at the nose, so it is responsible for the smell. Then 2 is located in the place of the 2 eyes. So it is responsible for the vision and all. Then 3rd is the oculomotor. Oculomotor is situated in the above the eyes. So this oculomotor nerves will supply the muscles of the eyes. They will be responsible for the movement of our eyeballs, then ciliary muscles and all. So these are also located in our eye. Then 4 is the trochlear. Trochlear is 4 is written in between the eyes. Okay, so we can see this trochlear. They will supply the superior oblique muscles of the eye. So these are also responsible for the movement of our eyes. Then trigeminal. Trigeminal is 5 number, right? So 5 number is located all over all over our eyes and nose and mouth. So these are responsible for the movement of the mandibles or mandibular and the ophthalmic nerves also. Then next is the 6 is the abducens. It is located near our temples, right? So this 6 it is responsible for the lateral rectus muscle of the eyeballs, causing the abduction and all. Okay, so this is also responsible for our eyes. So when we assess the cranial nerves, we will always assess this one 3, 4 and 6 together. Okay, the first one sensory smell. The first one is olfactory, that is responsible for the smell. That one will access separately. Then 2 optic will assess separately. Then 3 oculomotor, trochlear and abducens will assess together. The next comes the trigeminal. Trigeminal means the mandibular and like the mandibular and maxillary movements and all, how the patient will if the patient can open the mouth movement, speech and also these all are responsible by through the trigeminal. Then next comes the facial. Facial is located in the around the face, right? So it is composed of both motor and sensory nerve fibers. So we should always remember that those sensory will be responsible for the sense only. Then motor is responsible for the muscle movements. So the olfactory is sensory, optic is sensory, oculomotor, trochlear and trigeminal, oculomotor, trochlear and abducens. Okay, it is motor. Okay, so these are responsible for the movement. Then trigeminal is again mixed. Then facial is again mixed. Okay, facial means the how the impulses are carried around our face, like the person can all the things that we can do in our face, like smiling, frowning, grimming, etc. So these all are responsible by the facial nerves. Then next is the acoustic. It is also known as vestibulocochlear nerve. Okay, so this vestibulocochlear nerve is located in our ears, so obviously it is responsible for our hearing. So the impulses will go from the auditory nerve to our cochlea from the inner ear, then it will pass to our brain. So this is responsible for hearing. Here in the assessment, here we can do the you might have heard of the Rennes test and Weber's test and Rennes test that we can do with the help of the tuning fork. Okay, so these tests are included under the vestibulocochlear nerve. We will check whether this nerve is working or not by checking this test. Then next is the glossopharyngeal nerve. Glossopharyngeal nerve is the ninth nerve. Okay, so it is located inside our tongue, inside our mouth, right? So 9 is written inside our mouth. So it will be responsible for stimulating the muscles of the tongue and the pharynx and secretion of the parotid or salivary glands. Okay, then next is the vagus. Vagus is situated inner to the glossopharyngeal. Okay, there is a 10th cranial nerve. So this nerve are responsible for the controlling the various parts like pharynx, larynx, trachea, bronchi, etc., esophagus, etc. So gait reflex and all we can check through this vagus nerve. Then the next is the accessory nerve, that is the 11. This will supply the muscles of the neck like the sternocleidomastoid muscle and the trapezius muscle. So the movement of our neck, the rotational movement, side lateral movement and all, so these are controlled by the accessory nerve. Then the last nerve, that is a 12 cranial nerve, is hypoglossal. Hypoglossal, by the name itself, it is related to the swallowing and speech. It is mainly responsible for our tongue movement and all. Okay, so these all are about the cranial nerves. So you should all remember the names of the cranial nerves. If it is whether it is sensory or motor or mixed, then the functions. Then next we'll see the autonomic nervous system. In the autonomic nervous system, it is divided into two, parasympathetic and sympathetic. Sympathetic will arise from all the thoracic and the first three lumbar segments of the spinal cord, and this parasympathetic will arise from the 3rd, 7th, 9th and 10th cranial nerves, and from the 2nd, 3rd, 4th sacral segments of the spinal cord. Okay, so this sympathetic will be responsible for the fight or flight action, whether the person will react or the person will flight, means whether the person will escape, okay, from the work. It is under the E division. That means that we can remember the E, letter E. It is because it is responsible for the exercise, excitement, emergency and embarrassment. Okay, so in these conditions this sympathetic will work. Then under the parasympathetic, it is we will remember the word rest and digest. So it is under the D division, so we'll remember the word D. That means digestion, defecation, diuresis. So all these activities are included under the parasympathetic. So we can also see in the picture, the sympathetic nerves are responsible for the fight or flight actions, and the various activities in our body that they control are, they will be responsible for the dilation of the pupils, salivation, they will inhibit salivation, then they will increase the heartbeat, they will relax the airways, inhibit the activity of the stomach, stimulate the release of glucose, inhibit the gallbladder, inhibit the activity of the intestine, secrete the epinephrine and norepinephrine, then relax the bladder and promote ejaculation and vaginal contraction. Then parasympathetic, it is just the opposite of the sympathetic. So under the parasympathetic, they will constrict the pupils, okay. They will stimulate the saliva, they will slow the heartbeat, they will constrict the airways, they will stimulate the activity of the stomach, they will inhibit the release of glucose, stimulate the gallbladder, they will stimulate the activity of the intestines, contract the bladder and promote the erection of the genitals. So all these activities we should remember the activities of the parasympathetic and the sympathetic, which are just the opposite. So this is all about the autonomic nervous system. So you should not confuse the classification. Under the brain and spinal cord we have discussed, right? So this is included under the central nervous system, and another classification is the peripheral nervous system, which include the spinal nerves, cranial nerves, and the autonomic nervous system. So these are included under the peripheral nervous system. That means central means it will remain at the center. Peripheral means at the side. So these peripheral nerves and spinal nerves, cranial nerves will carry the impulses from the central nervous system to and from the central nervous system. Okay, so these nerves will be responsible for carrying the impulses. then this brain and spinal cord will program the impulses which are coming from the muscle. So always remember the two nerves that is responsible, that is efferent nerves, which carry impulses towards the central nervous system, then the efferent nerves which will carry the impulses away from the central nervous system. Okay, so this is all about our nervous system.